Well, I think California is thinking about doing their own little microcosm of Obamacare, but that's what this is, essentially on a college campus level. It's a microcosm of the Obamacare mandate.
Yeah, this isn't the first time the university has done something like this either. A few years ago, the university issued a mandate requiring that all incoming students live on campus until their senior year, bumping up the average cost of attendance to about $70,000 per year. Now the university is adding this Obamacare light healthcare mandate that will add $2,700 to the tuition cost, requiring that students have not just any health insurance, but insurance that falls under their standards.
I am surprised that George Washington University is so unaware of the real world around them and the impacts that the individual mandate had on families that they are now trying to mirror the failed experiment onto their students.
The most expensive university in the nation has issued a mandate for student health care that will add an additional $2,700 to the already $70,000 per year bill.
Now they're saying everyone has to have coverage through the university unless you have another type of coverage which meets their strict requirements. They say that everyone needs to have maternity coverage on their plan. It seems weird for a male student to be mandated to have maternity coverage, but here we are.
Abigail Marone, a student at the George Washington University, says she was surprised by the mandate that received no previous publicity or awareness on campus.
The way that the news broke about it shows that the university is clearly trying to hide it because they're expecting backlash from students who don't want to be forced to buy coverage.
The article published by the school's publication, the GW Hatchet, broke news of the mandate in the piece, promoting improvement in university mental health care, something students aren't using to begin with.
It's typically unreliable, it's not very helpful, sometimes it happens in group sessions, which makes students uncomfortable.
According to Marone, students across the board are upset about the mandated tuition hike.
The reason why I think that everyone's so upset about it is because of the additional cost that is going to be burdened by low-income students. Students who previously had $0 towards health care insurance in the past now have $2,750. And to my knowledge, there is no financial aid to cover this.
Marone says that there are other ways that the university should be spending money to improve the well-being of students.
Dormitories are falling apart. We have cockroaches in the dorms, all kinds of disgusting bugs. There is mold in a lot of the dormitories as well. And I feel like they should be focusing on those things, which would also positively contribute to the health of students on campus, as opposed to mandating some coverage that they think is necessary.
Bottom line is this is an unnecessary tuition hike that forces something onto students that they, one, can't afford in some cases, and two, don't want.
$2,700 more, that could buy a whole heck of a lot of books or maybe a nice few meals for a semester or a quarter. So why are they doing this? I mean, what is the reason? Is it because of what they're seeing in Washington, D.C. and getting rid of the Obamacare mandate? They want to do one of their own?
They said that they wanted to decrease the cost of their current plan, which is almost $5,000 a year. So instead,
but that's an opt-in, right?
Yeah,
it's not mandated, right?
That is an opt-in. So instead, they're going to charge all students $2,700 to bring down the cost for the students that are using it. Yeah. It's ridiculous.
And the answer to that young lady's question, rhetorically, why are men paying for maternity? It's the same reason why men were paying for maternity in Obamacare, or still are in many cases, in many of these plans. It's because it has to be a one-size-fits-all in order for this to work, and there has to be a mandate. So that's what they're doing. They're creating their own little microcosm of Obamacare. But the bottom line is parents have to pay attention to what's going on here. They're the final line here of approval, and they can reject this by yanking their kids out of that school.
Exactly, and the students, too, should start stepping up because this is their bill that they're paying in cases of student loans that they have to pay for in the end. So not only that, and this is happening on several campuses across the country. This isn't just a GW thing. So students need to be aware that they are paying this for a mandatory health care when they might already have coverage under their parents'.
Right. One way or another, the liberals are going to get you. And this is one way to do it, and that is through so-called health care reform. I'm sure that's how they're packaging the whole thing. It's a wonderful thing for the students, when in fact it is nothing more than socialism. And hopefully the students and the parents are going to push back here. Let's hope so. Morgan, thanks.